Many people who are addicted to drugs say the lack of transportation is a major barrier, prevents them from completing drug counseling and drug treatment programs. IdeaStream's Marlene Harris-Taylor reports that one local hospital has now begun using Uber and Lyft to eliminate the obstacle.
Hi, I'm Michael. Hi. Hey.
Like many people fighting drug addiction, 40-year-old Mike used to have a car.
I had a beautiful Impala. What happened to it? It was repossessed when I went to the county jail.
Mike, who asked us not to use his last name, says he couldn't endure the pain and hopelessness of being hooked on drugs anymore. So he detoxed at Rosary Hall, located in St. Vincent Charity Medical Center. Then came intensive outpatient counseling, 4 to 5 days a week. Mike also moved to a sober living house, which is a group home for people recovering from addiction issues. The expert at St. Vincent say that's when it really gets hard. Temptation is everywhere.
Actually getting from the sober home to the bus stop can be a challenge because we have had clients tell us that, Mr. Howard, when I leave the sober house, I'm stopped by at least 3 drug dealers asking me, do I need anything? Or on street slang is, are you straight?
Orlando Howard says by the time people make it to Rosary Hall, they are often financially devastated. So even paying for bus fare is a challenge.
Our clients who have substance use disorders, they've burned all of their bridges. In most cases, they didn't burn them, they blew them up. So they don't have mama, daddy, husband, wife, sister, and brother there to support them anymore.
You for Alice?
50-year-old Alice says she's had several failed attempts to get clean. But this time, she's close to completing her outpatient counseling.
Hello, how you doing today?
Because she has the transportation when she needs it. The Uber and Lyft rides are paid for by the hospital. Alice says the free rides to St. Vincent and then back home again have made a difference.
If I'm out on the bus, I might have a thought to say, oh, well, I could stop this place and this place and this place. And that's not good for me.
Associate Medical Director of Rosary Hall, Dr. Ted Perrin, says the Uber Lyft ride program began as a pilot project in 2017 to see if it would help increase attendance rates of patients in counseling.
There's a fair amount of research that shows that completing an IOP program, an intensive outpatient program, is one of the strongest predictors of sobriety.
St. Vincent officials say so far this year, the attendance rate for patients coming to counseling with the help of the ride service is 90%. Before the Uber Lyft program started last year, the attendance rate for the counseling sessions was 76%. Uber Lyft services have been used by other hospitals to help patients get to chemotherapy and other services. But Howard says St. Vincent's program is unique.
So the program that we developed here and started here, which by the way is the first in the nation, the first substance abuse treatment facility to do this in the nation, has been a benefit to our clients because we've seen an increase in the number of people who are actually attending treatment and completing treatment.
Howard says it's being paid for through grants, including $45,000 from the local Alcohol, Drug Addiction, and Mental Health Services Board, which funded the pilot program last year. Dr. Perrin says the fact that addiction claims so many young lives makes it even more important that we invest in treatment and programs like this ride service.
As a society, in terms of years of life saved, every dollar in treatment, addiction treatment, is 3 times more effective than treating high blood pressure and 6 times more effective than treating high cholesterol in terms of saving lives, saving years of life.
For the patients who are using the ride service, it's about more than dollars and cents. Mike says completing treatment has given him hope and some peace.
It was hard. It was really hard. And I'm really happy today to be in a better place. And keep in mind, my life is not anything like I want it to be, ultimately, but it's a lot better than it was. It's nothing like it was.
Miss a story? Visit our website.